Parents often ask, does my child have to use fluoride? And the reality is, not everyone actually has to have fluoride. That's a shocking statement from a dentist. What we can do is evaluate what the dental cavity risk is for your child. If your child has a lot of spacing in between their teeth, or if they have no cavities really in your family and they don't drink juice or soda or any of those sugary drinks, they may not need fluoride. The CDC recently came out with a guideline saying that our children are actually getting too much fluoride whenever we brush their teeth. It's very, very important to use fluoride toothpaste on a regular basis. I always recommend that regardless of that cavity risk. However, it's important to use something called a smear. Not a rice, not a pea-sized amount of toothpaste, but a smear of toothpaste. Very, very minimal. That smear of toothpaste is until they're ready to spit. Most kids are not great spitters, if you've noticed, until they are about 3 or 4 years old. So use that smear of toothpaste, and then you can go up to that pea-sized amount of toothpaste. If you're spitting, it's good. Here's the kicker. You don't have to rinse your mouth with water afterwards. One of the sayings of a famous dentist is, brush, 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 spit, 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 go to bed. Fluoride is a great tool for dentists to avoid cavities. Fluoride in the water is actually one of the greatest public health things that we have done for our country. The cavity risk went down substantially since we have done that. However, everything in moderation is very, very important. If you have any questions about it and how fluoride can work for you, be sure to talk to your dentist.